a world-renowned cardiac surgeon, the Chief of Staff at the Trillium Healthcare Center, and a devoted and dedicated father and family man. He's Dr. Gopal Bhatnagar. I'm Bina, and he's here with me on One-on-One. Welcome to One-on-One, Dr. Bhatnagar.
Pleasure to be here, Bina. Thanks very much for having me.
You
have to call me Gopal, though.
Oh, fine.
Okay.
Gopal, you were recently appointed Chief of Staff at the Trillium Healthcare Center. What is your role and what are your responsibilities?
Well, the Chief of Staff is responsible for assuring the quality of medical care provided at the institution. And we do that at a number of levels. One is the obvious, how good are doctors taking care of their patients. But also in this day and age, we have to think about how efficiently they're taking care of the patients, and in the rapidly moving world of medical care, to ensure that we're taking care of patients in the most up-to-date manner possible. So that whole aspect of quality assurance falls under the province of the medical chief of staff. And I like to work with the staff, and now there's much more of an integrated team approach. So we work very closely with the chief nursing officer as well into designing teams that can provide the best care for patients.
Growing up, did you always want to be a doctor?
No, as a matter of fact, no. My father was in an engineering field, quality control. All my uncles were engineers, civil, mechanical, etc. So the only person who was in the medical field was a granduncle of mine, my Nanaji, a very esteemed surgeon in India, and actually is only one of two people in the world at that time who translated medical textbooks from English to Hindi. And he did this digitally. He woke up at 5:30 in the morning, and on legal foolscap, he would just handwrite. And this is at age 88. He would handwrite and translate large volumes of medical textbooks, 1,000-page books from English to Hindi that were then published in India. And I clearly remember the first day that I ended up deciding on medical practice. I was sitting and I was probably about grade 12, just graduated out of grade 12, and then we had grade 13 at that time. And he was interested. He asked me, well, Gopal, what do you want to do? And I gave him a number of career options. And he said, well, you ever thought about medicine? And then I said, well, I think medicine, that's too hard. And then he looked at me and says, you should never be afraid of hard work. And I think at that point in time, I really considered him my role model for pursuing a medical career. My parents were clear role models in working hard. Nobody could have worked harder than they did in their lives.
Now, when you decided that you wanted to be a doctor, what medical school did you end up going to?
I ended up going to the University of Western Ontario. Grew up in the London area, as you know, as we both did to a certain extent. And so Western was a natural choice for me. Most of the kids from my high school were going there. So ended up going there. And I really enjoyed the type of curriculum that Western offered and the atmosphere of the university. So I ended up staying at Western for my medical school.
What do you think makes a good doctor?
What makes a good doctor? I think sympathy and empathy. I think you can have technical knowledge, you can have all those things, but unless you have sympathy and empathy, then I don't think you're really going to apply to the best of your ability your knowledge, whether it be technical skill or medical knowledge about drugs and treatment to the patient. And there's still vast parts of medical practice that really have nothing to do with science and really have to do with feeling what's best for the patient. And sometimes that's not necessarily what would be traditionally thought of as the best treatment.
How long was your training, and what was the toughest part of your entire training?
How long was my training? Well, I went into medical school in 1982, finished medical school in 4 years, didn't need the remedial program, finished in 1986.
That's a good thing.
After that, there's about 12 years of training in general surgery, and in cardiac surgery, and thoracic surgery, and vascular surgery, and then some fellowship training for advanced surgical procedures thereafter. So it was about 12 years after medical school that I ended up actually getting into practice.
When you finished all this training, was it a sort of a sigh of relief?
Well, of course, the relief is that you're finished. The scary part is that now you're leaving a structured environment. Even getting a job as a cardiac surgeon is not necessarily as straightforward as it would seem, that there's not a lot of jobs for cardiac surgeons, and there are some great candidates, and I consider myself fortunate that I was able to get a position at the University of Toronto at the Sunnybrook and Women's Health Science Centre, and was taken on staff there. So that was really a dream come true in terms of being able to work in that kind of academic environment.
Stay with us. We have lots more coming out with Dr. Bhatnagar as we ask him about his beating heart surgery. Welcome back to One-on-One with Dr. Bhatnagar. Gopal, now you are sort of world famous for this technique that you've created called the beating heart surgery. What is this, and why would one want to have this done?
Yeah, Bina. Well, first I'd take a step back and say I didn't invent this procedure. It's got a long history, especially in South America, where they persisted with this. And in fact, way back to 1962, the very first coronary bypass operation was done by a Russian surgeon in this beating heart technique. What we've done at Trillium, myself, my other two partners, Dr. Ahmed and Dr. Cotrera, is really apply this to the largest population with the most complex coronary operations in Canada, and I think almost in North America. So we've been fortunate to have a great team that have allowed us to build this practice into the world cutting-edge technique that it is. But why do it in the first place? Well, just to recap to your viewers, the traditional coronary bypass operation that everybody thinks about is done by placing patients on a heart-lung machine and then stopping their heart. You don't take the heart out or anything like that, but we provided a potassium solution, and potassium will stop the heart. Nobody should try to attempt that at home, but nevertheless, potassium stops the heart, and then it's great because the heart's still. You can bypass the coronary arteries. Remember, these coronary arteries, to just give you an idea, a large coronary artery is about 2.5 millimeters in size. So most of the coronary arteries we bypass are about 1.5 millimeters in size. So having them stopped while you open them and take some suture that's finer than a human hair and stitch a vein or another artery to that coronary artery requires a high degree of precision. It's just technically easier to do with the heart not moving around. The problem is that the heart-lung machine itself requires tubes to be put into the aorta, to be able to put in different parts of the heart, and once patients go on the heart-lung machine, the type of flow and the reaction to the machine itself can be detrimental to the human body. Most people that are relatively healthy can tolerate that. You know, that's a testimony to human flexibility or perseverance. But we're seeing more and more people who have diabetes, who have weak kidneys, bad lungs, have had previous strokes, are elderly, people well into their 80s that can benefit from surgery. So the old ways of doing surgery led to increased complications. So when we designed and I set up the program at Trillium, my first and foremost desire was to be able to do the operations with the least risk for patients. So the beating heart surgery provides us that. Remember, patients come, they need their bypass operation done. The machine was just a tool, and could we eliminate that tool? And in fact, working in conjunction with industry partners and using existing technology, we've come up with devices that will hold the heart still, and with our anesthetists developing techniques, keep the patient's blood pressure, oxygenation, all that stuff very normal while we do the operation on the heart while it still beats. Now, the area that I actually do the bypass on is not moving because we use a device. We use a device called an octopus. It's called that because it's got two little pods that suck that little area of the heart and keep it still. It's a little suction device, and it's a rigid arm, keeps that area still. So I can open that artery and do a very precise and careful bypass to that artery, but without having to use the heart-lung machine. So that's the process we use in over 90% of our patients. We are the largest beating heart center in Canada because of the kind of team we've been able to assemble. And I think that what's that's done is it's cut the need for blood transfusions in half. It's almost eliminated the risk of stroke and kidney failure in patients. And in general, our patients flow through the hospital much quicker than in the old style operation.
Well, Gopal, obviously your training has continued well after you finished your whole medical sort of career and, I mean, your residency. But you've also taken a little bit of flack because you've suggested that sometimes old doctors, surgeons in particular, are resistant to change. Why do you feel this way?
Yeah. Well, Bina, I wouldn't label out either older doctors or younger doctors, but medicine is a very traditional occupation. it would be wrong for me to suggest that every surgeon was not trying to do the best for their patient. It should never be taken like that. But we all have comfort zones. You have the comfort zone. You like a routine in your day. I like a routine in my day. We know if we do something and we get very predictable results that are pretty good, or in fact are very, very good, then it's hard to change, because change means taking a risk. Now, we've had a process whereby we've been able to change, manage that risk, so at no time would we feel that we were threatening patients. But it does take, it is a more intense operation, so you do have to concentrate a great deal more. There's a certain anxiety level in the team until they get confident with this technique. And some people, you know, be it surgeons or physicians, engineers, lawyers, whatever profession, don't want to take that leap. So we have had discussions. Some of it's gotten out into the press, as you know, on TV, between surgeons that are advocates of the traditional operation under all circumstances, and myself, where I believe that beating heart surgery and the traditional bypass are just different tools that can be used with different patients. So I feel that the practice now is such that we can customize the operation to meet the needs of the patient.
Stay with us as we find out how Dr. Bhatnagar has faced personal tragedy and triumphed over it. Welcome back to One-on-One with Dr. Bhatnagar. Gopal, you're no stranger to personal tragedy. Unfortunately, your father and your brother passed away within a short time. When this happened, what was your initial reaction?
Well, yeah, 1993 was not a good year for my family. My father passed away suddenly while I was away, and we rushed back. And my brother had been diagnosed with leukemia and subsequently passed away a few months later from complications related to that. Well, I mean, grief and shock, it's indescribable, really, what you feel. And I think that people that have gone through it, it just changes your whole perspective on life. I think that as children, we resign ourselves to the fact that, in fact, your parents will probably precede you. The hardest part is to accept when your younger brother precedes you, because that's just not the order that it should happen. So I think, I mean, as hard as the loss of my father was, it was a loss of my brother, I think, that really set me back considerably. And I was still in my residency at that time, trying to finish it off. I got great support, in fact, from the surgeons that I work with in terms of understanding and that. But I think for a good year and a half, it was very difficult to get up and get to work and go and take care of people. And you tried not to resent seeing other people do well. You see other people in an intensive care unit recover and go on and do well, and then in the back of your mind you'd always think, well, how come they got to do well, and my father or my brother did not? But you reconcile yourself to it, and I think that as you certainly try and reach back to your faith and your spirituality to give you an understanding of the bigger picture, so to speak, and time does really help.
Now, going through these tragic events, what important lessons did you learn?
Well, you certainly learn that it becomes a very stark reality that medicine is not all powerful. You learn the limitations of technology and medicine. What else would I have learned? I probably learned so many things that it's, as I said, when you think back of it, it's almost like it's a blur. A couple of years are just a blur. I mean, of following those two events and everything that follows. I think I've learned that empathy and sympathy a lot. So when you sit with patients in times where tragedy has befallen them, then you're able to really understand what they're going through now and help them through that time. What I learned most of all is that in my dealing with patients now is that it doesn't matter, even small bits of information, small questions, if they're not answered, then there's never closure in that. And I do now invite patients. I've had patients, families come back a year or 2 years later following an event and say, well, this question came up from Uncle Fred. And it's an open invitation to sit with them, because even though that may be very small in a medical sense, that's something that they need closure on. They need to ask that question from their perspective. So I think I've learned a lot in relationships with families.
Now, you said that faith was very important. How important in your sort of everyday life is faith and religion to you?
Yeah. Well, I don't think that faith and religion are separate from life in any respect. I think that the way you conduct yourself, dealing in professionally and personally in your family, are all part and parcel of your faith and spirituality. So I think it plays an integral role in my life. And when you get up and people say, well, why don't you take some time off, or you should relax more and things, and I say, it's just impossible for me to do. And every day you have to commit yourself to perfection.
What do you think keeps you grounded and humble?
Oh, my family, absolutely. My wife and kids, Well, as far as humility goes, I have no reason not to be. I mean, the ability to perform an operation is a technical procedure. That's just a benefit of good genetics. My parents gave me the opportunity to train in medicine, and I had great teachers that taught me the operation, and a society that provides me an environment to be able to do that. So when you compare yourself to what else people are doing in the world. I mean, today with the tragedy in Pakistan, you see parents struggling to keep their children fed and clothed and warm. When you compare what you're doing to something like that, it's those people that should be proud of their accomplishments. We live in a great society that allows us every opportunity. My kids will, you go home, you take out the garbage, you play hockey, and you just be a regular person. And I think that keeps things in perspective as well.
Coming up next, we'll find out what makes this doctor's heart beat. Welcome back to One-on-One with Dr. Gopal Bhatnagar. Gopal, who has had the largest influence on your life so far?
So there's so many people. Well, I would say that in different stages, I mean, different people have, but I'm here because I think of the work ethic and ethics that my parents instilled into me. I never saw my father and my mother work tirelessly hard. As new immigrants here, we came in here in 1967, and society was very different then. We moved to a small town. I grew up in rural Ontario, so it had its own challenges. But that ability to work hard, just commit yourself, really try and take advantage of the opportunities was instilled by them. There's no question. I never heard any complaints about the amount of work, the type of work. You just did what you had to do to succeed. So I think at that stage in life, they were very instrumental in giving me the opportunities. And I would say that still, when I think today, if you're tired and you're getting up at 3 o'clock in the morning for another emergency operation, I still think, well, my dad didn't complain when he got up for the midnight shift, and his work environment was a lot worse than mine. I go to work, I stand in an operating room. Everybody does what I ask them to do, So they're the foundation.
Well, you also give back to the community in various ways. Even before you were Chief of Staff, you were very active in fundraising. Why do you believe this is a worthy cause?
Well, you take your health for granted until it's not there. And unfortunately, heart disease in the South Asian community is rampant. I'm sometimes surprised members of my own community, the South Asian community, don't appreciate how common it is. 50% of all the heart disease in the world occurs in the South Asian population. That's staggering. And it occurs in the people that are most successful. It occurs at a younger age. Still predominantly occurs in South Asian men. So it touches me in a very personal aspect. My father died of heart disease, so I have a very strong connection in that. My interests in the community have been not only from the health point of view, because I think that that's vital, but also in other community events and keeping the culture, keeping cultural activities, religious activities alive. I think that it's important for us to maintain a certain amount of that cultural identity, because I think it's positive for us as individuals, and as well to demonstrate the positive aspects that can help. I think we can contribute a great deal to the Canadian mosaic as well by having a strong culture.
Now, you could have sort of virtually lived anywhere. Why in particular do you like the region of Peel, the city of Mississauga? What advantages do you see being here?
Well, I used to live out in Markham when I worked at Sunnybrook, and what brought me to the Trillium Health Centre was the opportunity to set up the heart surgery program here. And of course, I've always felt that if you're going to work as a physician in the community, then you need to be part of that community. And Bhavna and myself and Sagar and Sawan, we moved out here to Mississauga about 5 years ago, and have in fact found it the most delightful place to work. I find the diversity here tremendous. Is that there's respect for all the cultures here, and yet you can partake of any one of them. The facilities here, the education, it's a safe community, and it's a growing and very vibrant. I mean, you can feel the energy in this community, and I think that it's a community like the hospital that doesn't want to be second to none. So I'm enthused by living in a place like this.
Tell us, how does a cardiac surgeon stay in shape?
Stay in shape? Well, for a great number of years I didn't. Actually, you would do a few things here and there. I think I maintained a significant amount of physical fitness when I was in the Canadian Armed Forces, and I kind of stored that physical fitness for about 12 or 13 years, where with residency training and starting a new practice, I wasn't all that active. I think now, though, that the two boys are getting older, they're getting much more active, and we hear so much about childhood obesity, about sedentary children. I mean, both my boys would love to just stay in front of the PlayStation, so I get them out. If they're going to ride a bike, I'll say, well, Papa will run, you ride your bike. And so I've always liked physical fitness and activity, and now I think I've got a bit more time to be able to do that. So aerobic work for the cardio workout, and I've gone back into my martial arts training. I do the Brazilian style jiu-jitsu now, which is a lot of fun, goes back to my judo days. So I try and be varied.
Well, Gopal, we wish you continued success in your career, and thank you very much for being here with us.
Not at all. It's a pleasure, Bina. Thank you for having me.
And that wraps up another episode of One on One. I hope to see you next time.